Hi everyone, my name is Eva Batayaman and I'm the Workforce Retention Coordinator at CCLAC. Thank you for your interest in CREW. And today I'm going to tell you a little bit more about the program and the details of the cohort that will be starting in August of 2022. So what is CREW? CREW stands for the Collaborative for Retention, Engagement, and Wellness. And CREW is a learning collaborative that consists of didactic training, group discussion, and individualized support for intervention implementation. So why was CREW created? CREW was created in response to workforce challenges relating to recruitment and retention that were compounded and exacerbated by COVID-19. We've seen a lot of burnout and high turnover, low morale, and need for wellness and mental health interventions within our member clinics. So the trainings for the CREW program will take place on Thursdays from 12 to 1:30 p.m. They'll start with a 15-minute opening activity, followed by a 1-hour didactic training on the topic for that week. That will then be followed by a 15-minute discussion in which participants can share best practices, debrief the training for that day, discuss any challenges that they're experiencing, and then also just provide each other with peer support in a safe and collaborative environment. We're really excited for this cohort to be able to connect participants with support from Expert Effect. Expert Effect will be providing coaching to our clinic teams, as well as providing one of the didactic trainings. Expert Effect will also be conducting in-depth assessments to really capture a holistic picture of the state of each clinic and which areas they may want to focus on for their interventions. Expert Effect will also be providing technical assistance in the areas of HR and stress and resiliency. This is the training schedule for the program. You can see it begins on August 25th with an orientation. The first didactic training session will focus on recruitment, followed by onboarding using a lens that takes into account justice, equity, diversity, and inclusion, followed by a session on strengthening organizational culture through communication. There will be a workshop in the middle of the program that Expert Effect will be providing information on data collection for clinics that may be interested in bolstering their data collection practices. The next session will cover retention practices in clinics. Then we will have a session that focuses on stay interviews and the importance of manager relationships. And then the final training session will focus on wellness practices for staff. We'll then have a closing session, and then we will reconvene after a break in December so that clinics can come together and share the interventions that they have been working on. So for the interventions, clinics will be provided a welcome packet that has a slew of different interventions that they can choose from. Each clinic will choose one intervention to implement throughout the program, and the areas of focus are engaged and supportive leadership, positive and safe work culture, diversity, equity, and inclusion, team cohesion, meaning in work, and workflow, HIT, and productivity. These interventions will span, interventions that require maybe more time and resources if clinics have that available to them. Otherwise, there will be interventions available that also require less bandwidth and less time. Interventions will be available to all clinics, no matter kind of where they are in their journey to support recruitment and retention within their staff. For the coaching piece, each clinic team will be assigned an Expert Effect coach that will support them through the intervention implementation process. There will be 3 sessions throughout the program to check in on progress and provide any resources that clinic teams may need. There will also be a follow-up session 3 months after the program has been completed to see how the sustainability of these interventions are going, and if clinics require any maybe longer term support or connection to resources. So these coaches are really here to connect teams to anything that they may need and support their progress throughout this process. So teams will be made up of 3 to 5 members from each clinic. Teams must include one C-suite employee that has the authority to make decisions and impact organizational change. And all team members must attend trainings and coaching sessions. So some resources that will be available to participating member clinic teams. The first is our Crew, which is a sort of an online platform. It has sort of a Facebook functionality in which program participants can share resources, post questions to each other, as well as the CCLAC team can provide program updates or reminders. So it's just this kind of forum that participants can use to stay connected and share information. Additionally, CCLAC has its workforce resources, which is a clearinghouse workforce resources, including sample job descriptions, loan repayment guides, and other resources. Additionally, all of the subject matter experts that present for the didactic trainings will also provide resources to participants as well, and those will all be housed in the chatter. So this is just some feedback from our previous cohort. One participant said, previous to Crew, nothing was being done around retention or recruitment. Because of Crew, we implemented regular huddles to better understand the training needs of our staff. Another participant said, what has changed since Crew is my perception of an employer's responsibility to create opportunities for wellness at work. And one last quote from a participant is, the content was excellent. Coaching and meeting with the team were helpful to give time and space to discuss and innovate. So this can kind of give you a sense of the experiences of participants in the first cohort. As part of this program, each clinic team that completes Crew will receive a $1,000 stipend to further their efforts in the areas of recruitment, wellness, and retention. Full attendance of trainings and coaching sessions is required to receive this stipend. So thank you so much for your interest in this program. I really hope that you apply. The link to the applications is here. Applications are due by Friday, July 8th, 2022. And please feel free to reach out to me if you have any questions about the program, about anything involved. I'm happy to answer them, and I'm excited to see you all as part of the new Crew. Thank you.